Can you die from a broken heart?
So there is actually a condition of what we call broken heart syndrome.
Hello everyone, my name is Nelson. I'm a family doctor in private practice and this is Dr. Jeanette.
Hi everyone, my name is Jeanette and I'm a heart doctor. I work at Alexandra Hospital.
Today is the 29th of September, which is World Heart Day. Yay! So this is a special edition covering some of the heart problems. And we thank you for all your questions. The first question is, what are some signs of heart problems? Heart problems can present with many different symptoms, but we commonly group them into three major groups.
So the first category referring to the lack of blood flow within the heart muscle. So some of symptoms related to this would be pain in the central part of the chest area. Sometimes the pain might be on the left or on the right side of the heart. This pain can also be in the jaw or in the neck area. Some people might experience this pain that travels down the left arm or even the right arm. Sometimes you will also feel breathless or you might feel exceedingly sweaty when these symptoms occur as well. The second one would be that related to heart failure symptoms. You might get symptoms such as breathlessness, swelling in your legs. You might also feel breathless in the middle of the night or breathless when you are lying flat.
The third category relates to the rhythm of the heart. Sometimes the heart may not be pumping at the correct rhythm and you may feel your heart is very fast at moments, very slow at moments, you miss a certain beat, or you may even feel lightheaded. For these symptoms, you should seek a doctor for further consultation and evaluation. I have high blood pressure, high cholesterol and diabetes. Am I at risk of heart attack? Yes, yes and yes.
These three are the three biggest risk factors of heart disease because these three can cause the buildup of cholesterol layers within the blood vessels of the heart, and this results in a heart attack.
So what we should do is that we should regularly see our family doctor for screening, where the doctor can help you detect some of these risk factors early, because early management and control will help you to reduce your risk of a heart attack. Why does my heart skip a beat?
Okay, so when a heart skips a beat, it just means that the circuit or the electrical rhythm within the heart is not as smooth or regular as it should be. So there are two broad categories to the skip beats. The first category is one that is not so dangerous, what we call ectopic beats. And what can cause these ectopic beats are things like medications like decongestants or antihistamines that your doctor might give you for flu or runny nose. Alcohol, caffeine can also sometimes trigger off our skip beats. And the second one, which is quite commonly seen, is atrial fibrillation. These tend to be more dangerous because they can be associated with things like a stroke. So definitely do go and seek medical advice if you encounter any skip beats.
Okay, the next question is very interesting. Can you die from a broken heart?
So there is actually a condition of what we call broken heart syndrome. What happens when the heart goes through intense emotional or sudden physical stress? The body releases certain chemicals, and these chemicals can affect the shape and the function of the heart.
Oh, so you must watch out for that, right? So don't get your heart broken. Our next question, we've got a question on family history. My parents have heart disease. Will I also have heart disease? What do you think, Dr. Jeanette?
There are many different types of heart disease that can be inherited, but some common ones would be that are related to the heart valve condition. For example, like bicuspid aortic valve, or even conditions that are related to the heart muscle, meaning like your cardiomyopathies. These result in the heart becoming thicker or weaker over time.
And in general, if your parents have heart attack, especially at an early age, before the age of 40, you should be at increased risk and you therefore should go for more regular screening and a discussion with your family doctor or your heart doctor. We often read in news about seemingly healthy and fit people collapsing and dying midway during exercising, such as running a marathon.
These are people who may have risk factors that we mentioned earlier, such as high blood pressure, high cholesterol, or even diabetes, and may not be aware that they have these conditions until something serious happens.
And a good safety tip is that in general, if you're feeling unwell, for instance, you just had fever or an illness recently, you should not exercise for a good period of time so as to allow your body to recover and recuperate. And when you resume exercise, do exercise at half your usual strength before moving on to the full strength. And at any time during exercise, if you feel unwell, for instance, you're experiencing chest pain, you should stop immediately and seek prompt medical attention.
So importantly, even though you might be fit and very physically active, do get yourself checked for these conditions, especially if you are above the age of 40 or if you have a very strong family history of heart disease.
Is keto diet good for my heart? So keto diet is a diet in which you want to go into ketogenesis, where you are mostly on fat and oily food and you are burning away the sugar.
Patients come to me asking me very similar questions, and most of the time they tend to eat a very fatty food and they don't have a balanced diet. So always very important is to have a balanced diet and not to have extremes in your eating options.
The next question is, any tips on how to care for your heart? From a family doctor perspective, we do recommend that you see your family doctor at least once a year to do a discussion on whether you need any health screening for your age. And if you have any risk factors such as smoking or excessive use of alcohol, this should be stopped to help you to maintain a good and healthy heart. And that's all the questions we have for today. Thank you for spending your World Heart Day with us today.
And always remember to take good care of your heart.
Bye-bye.
Bye.